tells the doctor what type of pain, where the pain coming from, and what can be done with it. That is where the doctor comes in to implement the pain management modalities or procedures that will relieve the person's pain out.
So let me interject this to go on here now. Um, Slip this. You have to take an operation, or what you're gonna do to get rid of this pain.
Well, slip discs are definition for a spinal column, or, for instance, taking as an example, you have a block of cement blocks set up and you push one forward. It changes the dynamics, the structure, and the stability of the spine. So when you have a slip disc, you have a problem where the buffer or the substance holding the disc together moves away. It might cause a little bit of a bulge. So if you have an MRI or CT scan, the doctors might tell you have a bulge disc, but this bulge can burst. It can pop out, and the content of the disc come out, and it impinges on the nerve. So when it pinches on the nerve, we call it something commonly called as sciatica. You might have a sciatica or something that will radiate into your legs. It makes your legs dumb, weak, and you can't walk properly. It even changes your posture. So when these problems come in, the doctors are able to diagnose it. Sometimes they go in and do extraction. They'll take the disc that burst, the content out, and release the pain or the pressure on the nerve. However, sometimes they have to go in to remove or rearrange the disc to bring it back, and the doctor can add on to what I'm saying.
What is the advantage and the disadvantage of doing such job on your back so close to your spine? What's the 50-50 chance you have after you do this operation?
Well, it depends on the type of pain that you have, but if you have something like a slip disc or sciatica, we could start with conservative care, and if that fails, we move on to something a little slightly more invasive. We can do epidurals, facet injections, transforaminal injections. These are all slightly more invasive than conservative care, but definitely less than if you had to go through a back surgery. Most of the time, these procedures alleviate your pain to the extent that you can do physical therapy and get greater benefit from it. We do have a website set up called www.paininnewyork.com, where you can look at videos in English or Spanish that will show you and demonstrate exactly the procedures that we do and the types of pain that you may or may not have. It's a good educational component, and I urge you to check it out. If you do have any of these types of pain, such as pain going down your leg, tingling, burning sensations, pins and needles, or going down your arms, these are some of the types of pain that we specialize in that we can relieve you of.
Very good. So could you give us a website one more, www.paininNewYork.com. So get your pen, www.pain. Why is that pain in New York? I'm New York alone got pain?
No pain in New York was taken.
So we specialize in New York, nowhere else, right now.
We're starting with New York, but the idea is that there's going to be names underneath pain management specialists of New Jersey, Delaware, so on and so forth.
Thank you very much, Doc. Is anyone else want to say? Come over here, ma'am, please. Yeah.
Before the doctor go, right? As you look at the flyer, you see there's a lot of different pain, right? But I know it's gonna average. It's gonna be average pain that a lot of us definitely have, right? So as we look at this list, okay, well, headache is common, lower back pain, lumbar spinal. There's some that's pretty common among everyone, right? But briefly before you go, I just want you to explain to the listeners of some of the basic pain that a lot of us face, and how they can be treated.
Well, the older population commonly suffers from pain such as arthritis, which is due to the aging process. And then there's the type of arthritis that you get in your spine, which is commonly referred to as spondylosis. There's also discs vertebrae that slip on each other, and that's called spondylolisthesis. A lot of this pain is due to the vertebrae in your spine, which is similar to the joints in other parts of your body, and it impinges upon the nerves that feed to your extremities, your arms and your legs. And that's why you may have a disorder in your back, which actually you have pain in your arms or your legs. And that's the kind of pain that we diagnose and we treat. Other types of pain, I'm sure you've heard, herniated discs. We deal with failed back syndrome, facet joint syndrome, peripheral neuropathy, which is due commonly to a complication from diabetes. There's postherpetic neuralgia, which comes about from the chickenpox virus. Reflex sympathetic dystrophy is a very serious pain disorder, which is more of a pain syndrome. There's sacroiliac joint disease. If you have pain in your hips, that's localized to your buttocks or just in your thighs. We also deal with common pains such as headaches, which we'll diagnose and treat. We work with cancer pain patients, which is sometimes more serious. Things such as trigeminal neuralgia and common whiplash injury, which you can get from a fall or from a deceleration-acceleration accident, also known as a car crash.
Yes, I will talk about the injuries involved in car accidents. Commonly, the whiplash that the doctor talked about, when somebody really ends you, you're standing on the stop sign, somebody who's using a cell phone or distracted come in and bang into your back, and you move forward, your whole body move forward, and your head move forward and backwards, and your whole body starts feeling pain. You immediately feel that the pain is going through your neck, going to your arms, going back to your middle back, into your spine, to your buttocks, and this is the common whiplash symptoms that you have to be aware of. And anytime you have whiplash, anytime you have any accident like that, you don't go home and say, oh, I'm going to get Motrin and sleep it over. Go to emergency room right away and get a doctor in the emergency room to stabilize you, because sometimes from that injury, you will be really, really in pain, and then tell them to send you to
Eastmed.
Pain Management Specialist of New York. That's where you're going to get most of your relief from. Thank you very much.
And the address is 3000 East Chester Road at the corner of AD Avenue and over there by Gunning Road. It's easy to find, East Chester. Then you have Gunning Road over there, and they have AD Avenue. It's formerly Platter, Jamaican Platter, and then it was changed over to African American restaurant, soul food restaurant. So all of you that used to eat here and to get you
used to eat here, now you can
to
treat
get
here.
food to nourish your physical body.
You just
Now you're
took my
going to
line.
be treated here now for your pain, because sometimes you was eating that meat you shouldn't eat and it go in the wrong system and you get pain because you know meat give you pain. You know, when you eat too much meat, it go in your system and clog it up and pain take it. So the doctor is here to release it, right, doctor?
That's correct. We have state-of-the-art facilities.
Right, state of the art. I walk in there, Mr. Genius, as you've seen us, and I saw all these equipment in there. They have the bed, you can lie down, stretch out your feet. They have the machine and everything to test you. It's so, you know, doctor, this is one thing I want to, young people think that they can't get pain. Tell them that they can't get pain, no?
Of course, young people generally are involved in a lot of physical activities. They get sports-related injuries, and that type of pain we specialize in as well.
Sport management.
Sports injury medicine.
Okay, you did that. So if you're playing soccer or baseball or whatever, and you feel that you have a pain in your knee, what can you do for the knee? Do you replace it with a new cap or something like that?
Oh yeah, we have a full stock of knees in stock, and well, I'm kidding, of course.
Pain in the knee, treat with RE.
I have a question for you.
Yes, sir.
I don't remember what age was I at the time, right? But I would say maybe 12, 11. I was riding my bike in the Caribbean, right? In the islands, right? And it doesn't matter what happened, but I fell off the bike. And I broke this arm. And until today, when it's real cold, or I lift something real heavy, it's still, I could feel it. I mean, what's the problem? Was it not treated the right way? Or, I mean, why is it after all these years, I still feel pain today?
Yeah, that could be due to a number of reasons. Without examining you and looking at your medical history and your studies, I couldn't give you a diagnosis, but I will say that if you had an accident when you were younger that's still bothering you, it could be due to the healing process, it could be due to the way it was treated at the time, and it could be due to some arthritis. Arthritis doesn't just occur in older people. If you have an injury later on in life, that pain can recur or nag you, as they say, just because of the healing process. So that could be one of the reasons.
If I lift something on both hands, I would feel the pain in the one that was broken.
Right, yeah, it could be the way that it was treated or the way that it healed at the time. To really get a definitive diagnosis, we'd have to do some diagnostic studies, do an examination, and go from there.